the shot glass is pivoted in my hand. So I have my guide hand always just to kind of protect, and I'm grinding in, pushing down right now. So I'm heading everything down, so this would be almost like face to face. I'm working all around the sides of that talus, and this doesn't feel good for me. And you're only able to put yourself through so much pain, so you're going to get good work done, but it's not going to be the same as somebody else getting their elbow into those areas. So I'm really grinding, pulling down into the tissue. Then I want to start to follow over top of the tarsals, heading into the metatarsal area. Cleaning all the way down to the toes. And if I finish that one pathway, I'm going to flip the shot glass around in my hand. I isolate and I pull back up. And you can hear, I'll shut up for a second. And that's little bits, and it does not feel good right now. And that's little bits of fibrous tissue. I'm just trying to put on the pressure so you can hear it in the videos too. But I'm putting that pressure on, and I'm grinding against those bones in the area as I work my way back up to the talus. Then you can flip it over and then do the same thing down the second one. One direction, pushing, and you can pivot a little bit of those angles, but I just don't want you jumping over bones. So it's all about control, and that's why it's nice in your hand, because you have a decent amount of control over this. So as I'm working around the ankle, I would just pivot my hip as I'm working it. If I feel like you have a lot of buildup on that medial side. So at nights, if you're hanging out with your girlfriend, you're watching a movie, it doesn't really matter. You're just working in, carving into that medial malleolus and working against and grinding that ankle bone. Then I'm going to flip it around and I'm pushing off of it. Push, and then I relieve the pressure. Push, relieve the pressure. So it's a constant grinding motion, but not a scrub. Same thing you're going to do working around your knee. That's about as high as I can get. So I would just kind of cross this because I want some form of relaxation there. You know what I mean? If it's straight out like this, I'm going to have some form of tension within the muscle bellies, tendons, and ligaments pulling on stuff. So if I just drape it over, it's nice and relaxed now. And I would do the same thing, and we're mostly focusing around the joints. I'm not going to do much in the belly over here. That's like that Theragun, or even getting your hands in there and doing a nice effleurage massage is going to be better than getting a shot glass in there. But the joints is where I can grind against, flip it over, and push away. And you can hear it in the shot glass, because it ricochets off the internal bits of it too, so you can hear it kind of grinding those fibers against the sides of the knee. As I'm working my way around, playing angles, pushing one way, flip the shot glass over, and pull the other direction. Same thing you can do with the wrist and hands. You just don't have that guide hand there to control it, so you really got to isolate a little bit more with that working elbow. Sometimes when I'm talking to you guys and I'm doing non-surgical, at the beginning you need that guide hand there for control to keep you in your areas. Once you feel like you own that elbow movement beside you, you can remove your hands sometimes to get pivoting in different areas, and I'll support my body weight as I'm working in, but it's about the control over the elbow. And you guys are great at the technique. You've clearly got lots of results working on your clients in California. But when I go to work on her hip opposed to you, it's like, wow, he's going deeper, but it feels better. It's the practice, guys. If you're not going to constantly practice, you're not going to feel that you can let your body go and completely give into the tissue. And so monitor that, especially when you're working on newer clients and you're talking a lot. You don't realize as soon as you start talking and you're trying to focus on doing the work, I'm going to tell you it's 20% shittier immediately. I don't care. It's impossible not to. Because your eyes aren't in your elbow, your focus isn't there, you're not letting go of your thoughts, you're kind of this thing and that, and then you're going willy-nilly a little bit. They don't realize it. But I'm saying you could get this amount of results or this amount of results. What do you want? And so over time, it just takes a little bit more practice to just completely isolate yourself in your mind, putting those eyes in the elbow, and lovingly pulling that tissue apart.